Welcome back to Just the News, No Noise. HHS Secretary RFK Jr. yesterday held a press conference, a pretty earth-shattering press conference, on what he calls the autism epidemic in America, and he presented new data showing that cases are rising from 1 in 36 children to now 1 in 31. So what could be the culprit? Joining us now to discuss that, as well as more information on the COVID vaccines, is world-renowned doctor and chief scientific officer at the wellness company, Dr. Peter McCullough. Dr. McCullough, thanks so much for being here.
Thank you.
I think that there are a lot of folks in this country who anticipated what RFK Jr. was going to say. A lot of people suspected it, but now we have some data attached to it. Your thoughts?
Well, we have CDC data, and this is striking. So attention deficit hyperactivity disorder, ADHD, now 11.4% of all American children. Autism, 3.2% of American children. In certain areas, this is mind-boggling. California, little boys, the rate of autism, 12.5%. And these are year-on-year jumps now. It's going up asymptotically. It just cannot be due to increased detection or genetic drift. Kennedy is saying, listen, there's something going on and we need investigation. We need it now.
Yeah. There was a study, I think it was a decade ago now, we had the whistleblower on the show not that long ago, that raised some questions about whether the science was hijacked in an earlier study about whether there was a signal between vaccines and autism. Tell us about that, and should that be a big part of this review that Robert F. Kennedy Jr. has started?
Well, I can tell you as a medical doctor and an epidemiologist, complex syndromes like ADHD, autism, seizures, tics, these are complex syndromes. They don't have single factors, exclusive causes, if you will. They're always multifactorial. You know, the very first case of autism was described in the mid-15th century. It was kind of long before any of the stuff that we're thinking about is going on, but it's clearly accelerating. So risk factors is the best way to think about it. Risk factors for autism include parents at an older age conceiving children, women over 35, men over 40, premature delivery before 37 weeks, what's called common genetic variants, not things that are inherited through families. And then environmental exposures, the biggest one that's being investigated is combination vaccines. So it's probably not any single shot, but when they're given all together, the child gets very sick. Occasionally there's a febrile seizure. And for sure, when there's a febrile seizure, data from Europe show about a 40% conversion rate to autism. So I think you're going to see the lens really start to narrow down on these triggers.
Wow. The autism bucket and the ADHD bucket are two very different buckets. So I want to set the autism one aside. With ADHD, it seems like just from my friends who are parents, it seems like it is, I don't want to be callous, but it almost sounds like it's a catch-all diagnosis for a lot of doctors. I don't know if it's laziness, but do you find that to be true?
Well, I can tell you that, you know, the Diagnostic Statistical Manual for psychologists used to separate them, just like you did, that it's either ADHD or autism. And the most recent version now, DSM-5, says that they can overlap. And I think there is some overlap. For sure, ADHD, there's a high rate of other medical problems. I do think it's overdiagnosed, particularly in children over 12. Now, the current criteria are children under 12, they have to hit a 6-point scale. But we're seeing widespread prescription of Adderall and Ritalin in older, children and adolescents and even adults. And I think they're taking it for academic performance. And so what we're seeing is a code that indicates ADHD and then a drug. And I think that's something that should be investigated.
So I want to talk quickly about long COVID, because CDC now says it is a long-term health concern for the United States. The one thing the CDC never talks about is whether there's any tie to the vaccine. You've been very clear on this. Tell us a little bit about what long COVID needs to be investigated for when it comes to the vaccine.
We believe the cause of long COVID is the spike protein. So the spike protein is the spine on the surface of the virus here. And it's installed in the body after the infection as well as the vaccines in high quantities. Now, recent research suggests that, in fact, there is an overlap, a blend. People get the infection, they've taken the vaccines, they get the infection again. So a paper from Germany by Daxner and colleagues shows about 70% of long COVID is really due to the vaccines, and it's all due to retained spike protein in the body.
Okay, and I want to hammer it again. I know I always ask you this, but it's because I want you to continue telling our audience. You have a protocol for getting rid of spike proteins. Tell us about it.
It's critical. McCullough protocol, base spike protein detoxification. It's now in a single product by the wellness company called the Ultimate Spike Detox, nattokinase, bromelain, and curcumin in combination with other natural products. We have thousands of patients under direct observation, emerging scientific literature, preclinical and clinical. It's all coming together. It is the way of people getting out of this problem of long COVID and vaccine side effects. We use additional drugs when needed, but this can be done naturally with an over-the-counter product like the Ultimate Spike Detox.
Yeah. Absolutely incredible, and something that I think is so useful. I don't think I've told you this. A friend of mine, her son, you actually treated. He had long COVID for 2 years, and now he's in the clear. So thank you on her behalf, and thank you for being here tonight. Dr. Peter McCullough, everybody head to twc.health/justnews and use the promo code JUSTNEWS to save 10%. That is a whole product line of incredible products that you can have for your home, for travel, whether you are facing any type of bacterial infections. They have something for everything that you might be concerned with. So the code JUSTNEWS at checkout at twc.health.